Hey guys, it's Molly coming to you with a little bit of information about how to deal with low back and hip tension and pain. Especially during this time. Right now it is March 22, 2020. I'm on day 8 or 9 of basically being indoors and not having the same routine as normal. You might not realize it, but a lot of times one of the places that we clamp down is in our hips. We often tense our jaws and also tense our hips. I actually have another video about headaches that you can learn about letting go in the jaw, but let's also focus on the direct area. If you're having pain in your hips from sitting more often, from just the stress, maybe you're working out more because you're home and don't have other stuff to do. So I'm going to show you a few things you can do for yourself. So the first thing, we're going to work on the glutes actually. So sometimes what people describe as low back pain oftentimes is coming or at least related to tension in the hips. So if you have a tennis ball, a lacrosse ball, yoga tune-up balls, something like this. This is a yoga tune-up ball. It's the medium-sized one, which is about the size of a tennis ball. That's a great thing to use for what I'm about to do. So I want to show you the area where we're going to be working. We're working on the glute medius primarily, as well as maybe into piriformis, but thereby we're also kind of working on glute minimus and glute maximus because they're layered over each other. But oftentimes people end up having a lot of pain right here. It's like right on the back of your hip bone. So here's the soft part of your low back, and then here's the top of your hip bone, and a lot of times people will have pain here right on that hip bone, but also then down into the softer part of the glutes. And we also have this triangular bone at the base of our spine called the sacrum, and people will feel tension along the sacrum, on the sacrum, and then finally all those muscles, most of them fan out and connect to the top of the hip bone. If you're an anatomy person, it's the greater trochanter, which is a round ball at the top of your, not your hip bone, but your femur, your thigh bone. So grab your ball, and then you'll lay down on the floor. That's usually the easiest way to do it. And then you'll take the ball and you'll just put it in the soft part of your glute. And so I'm just putting it right along the edge of the top of my sacrum. And what I've got my knees bent, I've got my forearms on the floor behind me, and that way I can kind of lift up my other hip that's not on the ball and move my hips. I'm not even moving my feet. They're just there to support me and push off of. And I'm finding those tender spots. I'm moving right along that triangular bone, the sacrum. And then I'm also moving out towards that top of the femur. You can kind of make like a semicircle around it if you can imagine that sort of ball at the top of the femur, and a lot of times people will have soreness right along there, as well as up a little bit higher on that hip bone. And then you can also even work right on the sacrum. Another way you might work on the sacrum is if you happen to have yoga tune-up balls. There's the two smallest one that comes in a little mesh bag that you can cinch, but you could also take a couple of tennis balls or smaller balls and put them in a sock or something like that and tie it tightly so that they're next to each other. And then what I'm going to do is actually work right on the sacrum. So I'll lay down again, and I'm going to go ahead and feet, again, same position, feet flat on the floor, forearms flat on the floor, and I'm just going to roll up and down the sacrum. And if you need pictures of it, just Google sacrum, Google gluteus medius, and that might help you picture where to be. So it might be like, oh, I'm just rolling over a bone, but there's actually a lot of muscles that run all the way up your spine that attach into the sacrum. Okay, so that's another thing you can do. All right, so a lot of that might help with low back pain. It might be manifesting actually in the soft part of the low back, but coming from there. Another thing that can be causing or contributing to low back pain is actually abdominal tension. We have the psoas muscle, the iliacus muscle. We also just have all the abdominals. And tension in the front of the body can actually be contributing to pulling on the lumbar spine and causing problems and pain in the back. So I like this move. This comes from Forest Yoga actually, and sometimes I've had some of my clients do this while they're receiving massage, but this is something you can easily do on your own. You can take a towel. I like to use a yoga mat and roll it up. What I do, I'll show you real quick. I've already got one ready, but just so you can see how I prepared that. Generally speaking, I'll do like a trifold, like so, and then I'll roll it up tight like a sleeping bag. okay? So you just roll it all the way to the end, and then what you can do is if this is too thick for you, you can always unroll it a little bit, or unroll it a little bit more, but I'm gonna start with it all the way rolled up. All right, so we're aiming for the soft part of the belly, so above the hips, below the ribs. So hopefully your roll kind of fits in that area, more or less, and you're just gonna lower down over it and be gentle, because you actually might be like, wow, when you lay over this, if this is the first time you've ever done this, there's often some sharp sensations, some really intense sensations. You might feel things back through your sacrum or even down into your legs, and that's all fine, but just be gentle. So like maybe start up on your forearms. You can actually reach back through your big toes to help bring out some of the slack from your low back. And then just nice deep belly breaths. So I'm gonna breathe into the roll. And then on exhale, I'm gonna let the roll kind of be relaxed into and let it sink down, like into my abdominal wall. And that's kind of intense for me right there. If you wanted to take it further, you could go ahead and lay down all the way. And that's kind of gonna get added in a little bit of a different way, different angles. Helps change the angle of the pelvis, so if something's felt like it's kind of jammed and you breathe into this area for a while, you actually can loosen things up. It's sort of like an internal massage. So you could do that for a minute, you could do that for 10 minutes, whatever you want to do. So that's another one. And then the final one is if you have a foam roller. You really do need a foam roller or something like a foam roller for this final one. But you can just go ahead. I start at the bottom of my low back, just above my hip bones, and roll up right down the center. I like to reach up through my arms. So you can see I'm just keeping my feet on the floor, knees bent, and they're helping me push. And then you might lean over to one side. So now I can kind of get that soft part of the low back on the right side. All I'm doing is just kind of like rocking. Just a rocking motion. And then maybe like you can let go a little bit more and breathe into that area. Oftentimes you might find soreness right along the spine there. And just let yourself sink into it. You could work on this area with a ball, but it could be a little bit too intense. So use your judgment on that. You don't want to tense up in response to the work that you're doing to help decrease tension. So just always make sure you're breathing and letting go. Like right now I'm tensing in my shoulder a little bit. Maybe I'm tensing in my jaw a little bit without knowing it. So pay attention to those things. And then you also might want to just do a quick round of foam rolling on your legs, because maybe your hamstrings are pulling on your hips, that's pulling on your low back, or maybe your hip flexors are really tight. So real quick, I'll show you on one leg. We're just going to do the upper leg, all four sides. It's not really a four-sided thing, but we'll get all angles. So I'm starting just above the knee, and I am leaning my weight into that right leg, the one that's on the foam roller. My left foot is flat on the floor, helping propel me, as is my right arm, my forearm. So I'm just moving through. I might want to straighten out a little bit to get the inside of the hamstring, get all the way up to just below the butt. And then you're going to move to your side. My yoga mat's getting a little bit tripped up here, but that's all right. I'm going to move to the side and get the back, kind of where the hamstring meets the IT band, and go all the way up to the hip. And you're just trying to keep your balance while your feet are both off the floor. Use your arms. And then you're just rolling up and down. If you find a sore spot, you can kind of rock or hold and breathe. And then I'm going to keep rotating my body. I'm going to get the outside of the quad, and you can go all the way up into the hip flexor. So that hip crease, you can kind of sit. That's oftentimes, tender. It's tender on me. And I'm just going to rock. I'll show you what I'm working on in a second. If you aren't able to visualize that, I'll stand up and show you. Now we're just continuing to rotate. Front of the quad. And then the last thing, don't forget about the inside of your leg, the adductors right here. There is a way to do that. I'm going to show you on the other leg so you can see. If you have a short foam roller, it's usually going to work better than the long one. The leg that you're not working on is out in front, and the leg that you are working on Actually, I'm gonna put the leg that I'm not working on in back so you can see. And that might work better depending on your flexibility. And you're just gonna work along that inside of the leg. And you might be surprised to notice, ooh, some tension there. And that's also gonna pull on the pelvis in certain ways if there's tension there. Just to show you what I was doing on that hip flexor, this angle right here, and then just sink into it. And you can kind of rock along that ropey part of the front of the hip. So hopefully those things can help you if you're experiencing low back pain or hip tension. Maybe you're laying in bed at night like I was last night and feeling like, wow, my hips really hurt. Just get up and you maybe grab that ball and do a couple rounds of work through there, and you might sleep better. So, all right, thanks a lot.